There are roughly 12 million Americans who qualify for both Medicare and Medicaid at the same time. And most of them have no idea they do, which means they're paying copays they shouldn't pay, missing benefits worth thousands of dollars, and sitting on a Medicare Advantage plan that is actively the wrong plan for them. Here in Arizona, that second program, Medicaid, is called Access. And if you have it, or you're close to qualifying for it, what I'm about to show you is going to change how you think about your coverage. I'm Andy Childs. I'm a licensed Medicare broker in Mesa, Arizona. Dual eligible coverage is the corner of Medicare I know better than any other. So today, I'm going to walk you through exactly who qualifies, what changes the moment you do, and the one mistake I see people make that costs them benefits they're entitled to. Before I get into it, I want to change how you think about something, because this is where most videos and most agents get wrong. Dual eligible isn't one thing. It's not a single category. There are actually multiple levels of being dual eligible. And the level you're at decides what gets paid and what doesn't. So when somebody calls me and says, Andy, I think I have both Medicare and Medicaid, my next question is never, okay, great. It's always, let's see what level you have. Because a person who's full dual benefit eligible and a person who's only on qualified Medicare Beneficiary Program, they get very different things and they need different plans. That distinction is the whole game. And once you understand it, you stop being confused by your benefits because you finally know what you actually have. So let's break it down. Picture this. You're 67, you live in Mesa, you're on Social Security, and your monthly income is somewhere around $1,400. You have a small savings account, maybe a car paid off, and that's it. You're already on Medicare, and money's tight. You're skipping a prescription every month or two because the copays are stacking up. You're avoiding the dentist because dental isn't covered. And your hearing aids, which you really need, feel completely out of reach. Here's the part that bothers me, that almost certainly that person qualifies for access. They probably have for years, and nobody told them. Their doctor didn't tell them. Their pharmacist didn't tell them. The agent who sold them their Medicare plan, if they had one, definitely didn't tell them, because most agents don't specialize in this and they don't know how to spot it. So the person sits there, eligible for thousands of dollars of benefits a year, paying for things Access would cover, on a Medicare plan that wasn't built for their situation. That's the problem, and that's what this video is here to fix. So let's start with the basics, because if you don't get this part right, nothing else is going to make sense. Medicare is the federal health program for people 65 and older, or under 65 with certain disabilities. Access, spelled AHCCCS, is Arizona's version of Medicaid. It's a state-administered program, but it's funded jointly by the state and the federal government. When somebody qualifies for both at the same time, that's what we call dual eligible. But here's the thing. There are different categories. The first category is full benefit dual eligible. That means you get everything Medicare covers plus everything Access covers. No premium, no copays, prescription drugs at a lower cost, dental, vision, transportation, all the works. The second category is QMB, Qualified Medicare Beneficiary. With QMB, the state pays for your Part B premium, your deductibles, and your copays. So you don't get the full Access benefits, but you stop paying the out-of-pocket costs that Medicare normally hits you with. Then there's Slim B and QI. Those are programs that pay your Part B premium only, smaller benefit, but still real money. Your Part B premium in 2026 is around $203 a month. So that's over $2,000 of savings a year. So here's how I want you to picture it. Imagine a staircase, and the higher up you go, the more help you get. At the very top, you have full dual eligible. That's the whole picture. Medicare and Access working together, and most things cost you zero. One step down, QMB. The state pays your Part B premium, your deductibles, your copays. Next step, Slim B. Slim B only pays premiums for Part B, but that still is over $2,200 a year. And the last step, QI, is also premium only, but funded a little differently. The lower your income, the higher up the staircase you sit. So when somebody calls me and tells me they're on Medicaid, my first job is to figure out which step they're standing on, because that one fact decides everything else. The income limits change every year. As of 2026, you're generally looking at QMB if you're under about $1,300 a month for an individual and $1,800 for a couple. But here's what most people don't realize. Arizona's full access limits go higher than that, especially when you factor in the Medicare Savings Program. So if you're listening to this and you're under, let's say, $2,000 a month for a single person or $2,700 for a couple, you owe it to yourself to check. Because if you qualify and you don't apply, you are voluntarily turning down benefits you've already earned. That's insight one. Now let's talk about what actually changes when you flip the switch. This is the part that I wish more people understood, because it's the part that hits the bank account. Let's say you're on a regular Medicare Advantage plan today. You're paying maybe a $20 copay to see your primary care doctor, $50 copay for a specialist, and $300 for an outpatient procedure. And you're hitting the donut hole on prescriptions every August. Your dental coverage on the plan is $1,500. Sounds fine until you need a crown and a deep cleaning in the same year. Now, instead, I want you to imagine you become full dual eligible. Here's what happens. Doctor visits, 0. Specialists, 0. Hospital stay, 0. Generic prescriptions, either free or $1.50. Brand names are going to be $4 to $11, depending on the year and your category. Then you stack the access covered benefits on top. Dental, actual dental, not the $1,500 allowance, but real coverage for cleanings, fillings, extractions, and dentures. Eye exams, hearing aids, all covered under access in a way they almost never are under Medicare alone. Non-emergency medical transportation, meaning access will literally pay for a ride to your dialysis appointment, your cardiologist, your physical therapist. That alone is a huge benefit for people who don't drive anymore. This is the part that hits the bank account. On the left, your Medicare or Medicare Advantage life today, $20 primary care, $50 specialist, $300 outpatient, prescription stacking up, dental capped at $1,500 a year, hearing aids out of reach, no transportation help. And on the right, your life is a full dual eligible. Most of those copays drop to 0. Generic prescriptions are about $1.50, dental gets real, hearing aids are actually covered, and access will pay for your ride to your dialysis or your cardiologist. Add it up, and the typical Arizona dual eligible saves between you $4,000 to $9,000 a year. Couples save even more. If I had to put a real world dollar amount on what dual eligible status is worth to a typical person in Arizona, I'd say somewhere between $4,000 to $9,000 a year, depending on how much healthcare they use. For a couple, the number's even bigger. But, and this is the part nobody talks about, those benefits aren't automatic. Access doesn't show up at your door with a welcome basket. You have to apply. You have to reapply. You have to know what you're applying for. And once you're enrolled, you have to make sure your Medicare plan actually plays nicely with your Medicaid status, which is exactly where the trap is. Here's the mistake I see more than any other in my practice, and it costs people money every single month. Somebody becomes dual eligible. They finally apply for access. They get approved, and they leave their Medicare Advantage plan exactly the way it is. They figure, I had a plan that worked, so I'll just keep it. Access is a bonus. That feels logical. It's also wrong. Here's why. There's a special category of Medicare Advantage plan called a DSNP, Dual Special Needs Plan. It's literally built for people who are dual eligible, and it does the things a regular Medicare Advantage plan can't do. A DSNP coordinates your Medicare and your access so they actually talk to each other. It bundles your benefit. It usually includes a monthly over-the-counter allowance, meaning a card you could use at a Walgreens or CVS for things like Tylenol, vitamins, and toothpaste, and even some grocery items on some plans. The over-the-counter card alone can be worth $100 to $200 a month, depending on the plan. DSNPs typically include coverage for better dental, better vision, more transportation, and a care coordinator. Actual humans whose job is to help you navigate your appointments, prescriptions, and specialists. None of that comes standard on a regular Medicare Advantage plan. Here's the side-by-side. On the left, Medicare Advantage plan, most dual eligibles wrongly stay on. Basic dental allowance, no over-the-counter card, limited transportation, no care coordinator. On the right, a DSNP, a real dental, an over-the-counter card worth $100 to $200, expanded transportation, and an actual human assigned to help you navigate the system. The arrow in the middle is the most important part. SEP, Special Enrollment Period. The moment your dual eligible status changes, the law gives you a window to move from the left box to the right box. You don't wait until October. You don't wait for AEP. You can move now. So when somebody stays on their old non-DSNP plan after they become dual eligible, what they're really doing is leaving thousands of dollars in benefits on the table every year. The worst part is the law gives you a special enrollment period the moment your dual eligible status changes. You can switch plans outside of the regular annual enrollment period. Most people don't know that. So they wait until October like everyone else, and they spend a full year on the wrong plan first. If you take one thing away from this video, take this. If you become dual eligible, you have a window to move to a DSNP, and you should use it. Not next year, but now. That's where a broker like me actually earns the work. I look at your access category. I look at the DSNPs available in your county. Maricopa has more options than most parts of the state. And I match you to the plan that pays the most for what you actually use. All right, let me bring it together fast. First, dual eligible isn't one thing. It's a spectrum. Full benefit, QMB, Slim B, QI. The levels matter because it changes the benefits. Second, when you become dual eligible, the financial picture gets dramatically better. We're talking thousands of dollars a year in copays, premiums, and benefits like dental, vision, and transportation that you didn't have before. Third, the moment your status changes, switch to a DSNP. Don't sit on a non-DSNP Medicare Advantage plan. The special enrollment period exists for a reason, so use it. That's the framework. Status, savings, switch. If anything I just said sounds like it might apply to you or to your parent or to somebody you care about, hit subscribe. I do 2 videos a week. No fluff, no upsell. Just Medicare explained the way I explain it to my own family. And if you want to talk through your specific situation, whether you are dual eligible, whether you might qualify, or whether you're on the right plan, there's a link to a free consultation in the description, and you can find my number there. Working with me costs absolutely nothing. The carriers compensate brokers directly. So my job is just to make sure you end up in the right place.